Hi everyone, my name is Franco. I'm one of the nurses from the Orthopedic Institute at Macquarie University Hospital. Now, please forgive me, this is my first recording. I wanted to record this session so I can reach out to as many staff as possible so we can, deliver this in service in a timely manner. Now, please bear with me. I may have some lag time finding icons and buttons and how to go to the next slide, but please bear with me. Now, today we'll be discussing about the National Safety and Quality Health Service Standards. We have 8 of them, but we're not going to be talking about the 8 for now. The 8 national standards are clinical governance, partnering with consumers, preventing and controlling health care associated infections, medication safety, comprehensive care, communicating for safety, blood management, and recognizing and responding to acute deterioration. Now, for this session, we will not be discussing all 8 of them. We will be just focusing on the first one, which is the clinical governance standard. The overall objective of this session is to promote awareness of the clinical governance standard. And for that, we want to understand the concept and the role of this clinical governance in ensuring delivering of quality and safe healthcare. We also want to identify and analyze the different components or criteria of this standard. Also, we want to recognize the different systems, protocols, and procedures under each criteria or component of this standard. And lastly, we want to learn and understand the different roles and responsibilities of each stakeholder in a healthcare organization towards this clinical governance. Now, as you know, leaders and every member of the healthcare organization is responsible to the community for delivering safe and high quality services or care. What is clinical governance? Now, to be honest, among the 8 national standards, clinical governance is probably one of the least popular. This is the standard that most staff are not paying much attention to. We may be quite familiar with, say, medication safety, infection control, responding to acute deterioration, but clinical governance, we less likely pay attention to this. We don't even know sometimes like what this means. Now, according to the Australian Commission on Safety and Quality in Healthcare, or the Commission for short, it says there that the clinical governance is the set of relationships and responsibilities established by a health service organization in between its stakeholders. For what purpose? To ensure that quality and safe services will be delivered to patients and consumers. If you will look at that definition, it's kind of vague. We don't really understand what sort of relationships, what sort of responsibilities are we talking about here. Now, first, when we say between stakeholders, we're talking about the Department of Health, the governing body, say the board members of a health organization, the leaders, the executives, the workforce, staff nurses, the patients, and the consumers. Those are the health stakeholders. Okay, now it says their relationships. What do we mean by that? When we say relationships, it pertains to the line of the organization, like who reports to who directs who. Okay, so there are sets of that. There's like a framework, like there. That's why we've got organizational chart. Okay, so you can see the relationships there. Who's on top? Who's in the next line? The next line. Who's on the sideline or something? Who's not really needed? And it says also there responsibilities. When we say responsibilities, of course, each role has got job descriptions. What do they do? And when we say responsibilities in terms of governance, their roles, their tasks in ensuring that safe and quality care will be delivered. Now, what is the aim of this standard? Now, the clinical governance standard actually aims to ensure that there's a structure, there is a system in place and implemented to make sure that patients will receive safe and quality care. The clinical governance standard has its components or criteria. If you visit the site of the Australian Commission on Safety and Quality in Healthcare, or the Commission, you will find them there. We will be talking about all of them one by one. We've got governance, leadership, and culture. We've got patient safety and quality systems. We've got clinical performance and effectiveness. And the fourth one is the safe environment for the delivery of care. The first component is the governance, leadership, and culture component or criteria. In this component, this is where a certain clinical governance system or an overarching system or a framework ensuring that safe and quality service will be delivered is being set and being endorsed. And who endorsed this? Who set this up? These are the leaders. So in this component, it also involves developing leaders in an organizational and clinical levels to make sure that someone will be endorsing or implementing such framework. Someone will be building this framework in the first place and endorse it. And not only that, these leaders will also promote a certain culture, a work culture that will be focused on delivering safe and quality service. In patient safety and quality system component, this now pertains to the actual system, to the procedures in place. So this is kind of like now the tools that we want to use. Earlier, if you remember, in the clinical governance, we're talking about a broader strategy. Now we already have the strategy. In this component, this time we want the tools. And this is what the patient safety and quality system component is talking about. This is the actual procedures or protocols or the systems in place. Now, what sort of systems could be examples of this? Examples of these systems could be, the policies and procedures that we have, the risk management system that we have, the feedback and complaints management system, the health care records and how we manage them. These are just to name a few. Now, what sort of activities can actually be involved in such? In this component, this is where we develop policies, procedures, and protocols. This is where we also monitor clinical performances. That's why we have, performance appraisal. We also have feedback. We also have managing complaints and compliments. We also have like managing and reporting, adverse events or sentinel events. So these are the actual system. Another component is the clinical performance and effectiveness. Now, in this component, this actually talks about the workforce itself or the people itself. We want to make sure that the staff in that particular organization have the right qualifications, the appropriate qualifications, and the right competency to be able to deliver safe and quality healthcare. Now, the key tasks involved in making sure that staff have the right qualifications and competencies, examples of those that we have in place are safety and quality training. Examples of that is when we provide education and training to, say, new staff or new grads or those who just started in a particular role. We give them in services. We provide preceptorship, mentorship, or something. We also got performance management um, in a sense of performance appraisal or evaluation. We've got credentialing and scope of clinical practice. These could come first or while the employment is ongoing. Say before is kind of like the recruitment process. We make sure that we've got the right credentials before we hire that particular person. And then during the employment, we can also do credentialing. Say this person will jump into a particular role and for that person to be in that role, we improve or enhance his credentials, so we do something else, we add something else. Another is safety and quality roles and responsibilities. So we tend to give them their roles and responsibilities. We disclose to them their job descriptions. We show them the protocols and the systems and policies in place. Evidence-based care, this could go in terms of making clinical pathways. We make sure that the interventions and actions we will integrate in such pathways will be evidence-based. And lastly, we've got variation in clinical practice and health outcomes. Now, there will be times that clinical practices will be varied, whether it is intended or not intended. We want to make sure that we will see the health outcomes of those, and we tend to analyze and see where we can improve, see where could be the gaps and where we can hit those gaps, and the factors that we can enhance so that to improve these practices. The fourth component is the safe environment for the delivery of care. In this component, this talks about the work environment. We want to make sure that the workplace we have is safe for our patients. We want to make sure that it is supportive of giving a safe and quality care to our patients. And this could involve the building structure, the layout, the infrastructures, the design of the space. It also involves the equipment and instruments, making sure that they're all functioning well, they're fit for their purposes, they're hazard free. And we also want to make sure that there are systems in place to maintain and to monitor all of this. Examples of the things that we could integrate in this component in maintaining safe environment or safe workplace are hand washing facilities. We want to make sure we've got proper scrub sinks for hand washing or for scrubbing. We want to make sure that there are hand rubs in different places available. We also want to make sure that we don't have much tight corners. This is very important in maneuvering beds, especially moving patients. We want to make sure that we've got appropriate lighting. There are appropriate furnishings and surfaces. We want a smooth floor. We don't want any causes of trips and hazards. Workspace, we want an adequate workspace. We want to make sure that there are signs and maps in place to promote easy navigation, not just for nurses or staff or work staff, but also for patients and visitors. And lastly, another part of that is the accessibility of the nurses station. In our case, we've got the reception, which we also make as a nurses station. If you notice, it's in the middle. It's very accessible. Now, what are the roles and responsibilities that we could have for this clinical governance or for this standard? We can divide them into the different stakeholders. We can have the roles and responsibilities of the patients or consumers. We have the roles and responsibilities of clinicians or the workforce. We have the roles and responsibilities of the managers or the leaders, and the roles and responsibilities of the governing body or the board members. First, we've got patients and consumers. Now, their role in this clinical governance is to serve as our partner. It says there they can participate as partners to the extent that they choose. When we say partner, we want them to be involved in their care. It's like when we plan care, it's just not us who is planning this. We want to make sure that the patients or the consumers are involved. We want to make sure that we hear their inputs, we hear their opinions, we hear their ideas and thoughts and how they want their care to be given. So if you remember, like, they're actually the primary recipient of our care, so might as well hear what they want. So we want them to be involved. Now, this partnership, it says there, it can be about their own care, it can be in the organizational design and the governance. Yeah, this is, this could go from their feedback, their comments, their suggestions or something. Yeah, so we take them as our partners. So that's their primary role. Second are the clinicians. Now, our roles and responsibilities involve working within the well-designed clinical systems in delivering safe and quality clinical care. We all know that we already got, say, policies and procedures or a system in place to deliver safe and quality care. What we need to do is to be professionally responsible. We want to make sure that we'll be working within these systems, within our scope of practices. We want to make sure that we embody the work culture of giving safe and quality care, and we want to make sure that we are responsible for our professional growth as well. So that if there's any training that is lacking, or if there's anything that we are having difficulty, we tend to look for resources and seek support from our line managers. Third are the managers. Now, their responsibilities primarily involve making sure of the systems in place are well designed and are performing well. They wanted to make sure as well that the staff or the workforce are working within these systems, and they have this proper training, adequate support and education to maintain their competency. Managers also give advice or information to the governing body about the current system in place. So they tend to review this. If there's any issue or there are gaps in the design of a particular system, they report it to the governing body to contribute to the review and redesigning of such system. Last is the governing body. Now, the governing body's responsibility is quite similar with that of the managers, only that it is in a broader aspect. So if the managers are kind of like maintaining or ensuring that the systems in place in their work level are performing well or are well designed, the governing body is also like making sure that the clinical governance system or the overarching system is performing well as well, and it is being run effectively. They also are responsible for the continuous review of this system to make sure that this can be continuously be improved, and to make sure that it remains up to date in giving quality and safe services to our patients and consumers. Now we've come to the end part of our session, and to make sure that we've learned something, we want to summarize what we've discussed for this session. First, let's recall that clinical governance is actually the set of responsibilities and relationships established by a certain healthcare organization between their stakeholders. The clinical governance has its components or criteria. We've got one as clinical governance, leadership, and culture. Second is the patient safety and quality system. Third is the clinical performance and effectiveness. And fourth is the safe environment for the delivery of care. In the clinical governance, leadership, and culture component, we said that leaders tend to set and endorse a particular clinical governance system or the overarching system. The strategy. We also establish leaders and promote a certain work culture focusing on delivering safe and quality care. In the patient quality and safety system component, this pertains in particular to the systems and procedures and processes in place. These are the tools. Examples of such are the policies and procedures, risk management, quality improvement, so on and so forth. In the clinical performance and effective component, this talks about making sure that staff has the right qualifications and competency, and we make sure to have them by ensuring that they've got the right credentials, we've got adequate provision of training and education, we've got performance management and evaluation, and so on and so forth. In the safe environment for the delivery of care component, we talk about the workplace environment. We want to make sure that it is safe, and it involves the infrastructures, the layout, the design, the equipment and instrument, making sure that they are well functioning and they are fit for their purposes. We also want to make sure that we've got a system in place to maintain and that this work environment is safe and supportive of giving quality care to our patients. And we also recall that stakeholders have significant roles in the clinical governance. And if you remember, we just divided them into each stakeholder. Patients and consumers, they participate as our partners. They get involved with their care plans, the design of delivery, and they can also give us feedback, comments, complaints, suggestions, which could also direct our design for organization and the systems or clinical governance systems. Clinicians, our responsibility is to work within the policies and procedures or the systems in place. We also want to be professionally responsible for our growth. So if we need some training, we seek support and help from our line managers. Managers, their role is to maintain that the systems in place are running well or as being implemented effectively. They give feedback to the governing body whether this design is not good, and they help with the redesigning and review of these systems. The governing body responsibility is quite similar with that of the managers, as I told you earlier. Only that is their responsibility is quite broad or more overarching. So their system that they want to maintain is the clinical governance system. And there you have it, ladies and gentlemen. Thank you very much again for listening. I hope you learned something, and hopefully you get some time to watch this webinar. Thanks again, and next time we'll be discussing about the second standard, the partnership with consumers.